Good evening and welcome to tonight's presentation. We're going to be discussing the state of men's health and having a candid conversation with a team of public health experts. As we head into tonight's presentation, I'll be introducing you to your moderators for this evening and the presenters. I am Jacinta Logan, president of the Men's Health Equity Institute, and I'll be serving as your moderator for this evening. We are also joined by some wonderful individuals with a wealth of knowledge on this topic. You will be hearing from Mrs. Deshauna Ballard, who is a public health educator, and she serves as the Vice President of Communications and Curriculum Development for the Men's Health Equity Institute. Joining Deshauna will also be Mr. Antoine Martin, who is the VP of Operations, and Dr. Kristen Allen Watts, postdoctoral fellow and vice president of community engagement for the Men's Health Equity Institute. So, a brief overview of the Men's Health Equity Institute. The mission is to help reduce and eliminate health disparities by addressing health inequities experienced by men as a result of the social determinants of health and the political determinants of health in partnership with community organizations, healthcare providers, and government agencies. The vision is to improve and protect the health and well being of all boys and men, regardless of their race, national origin, age, disability, gender identity, religion, beliefs, sexual orientation, veteran status, parental status, or other protected status. The Men's Health Equity Institute is founded upon four pillars, which uphold the values of the organization. They are education, research, service, and policy. We would like to recognize Dr. Georgiana Logan, who is a professor and research associate and serves as the founder and executive director of the Men's Health Equity Institute. We thank you for your vision and dedication in leading the charge to address men's health. As we move forward on this evening, by the end of this presentation, we hope that you will be able to recognize differences in life expectancy and for men and women in the U.S. We hope that you will be able to identify social determinants and political determinants that impact men's health. And as a group, we hope to recommend strategies and solutions to address men's health in the U.S. Before we get started, let's review a few definitions so we make sure everyone is on the same page. You'll hear us talk about life expectancy, which is the amount of years one is expected to live from birth. You'll also hear the term social determinants of health, or SDOH, which are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life, outcome, and risk. Also on this evening, you'll hear the term political determinants of health, or PDOH, which are political systems and strategies that have historically and currently disadvantaged or advantaged individuals that may serve as the root cause of many injustices and inequities in society. One's life expectancy can be influenced by the social determinants of health, the political determinants of health, by either increasing or decreasing the amount of years one is expected to live. There are several factors that can impact someone's life expectancy. The social determinants of health have a major impact on people's health, well-being, and quality of life. The examples of the social determinants of health include safe housing, transportation and neighborhoods, racism, discrimination and violence, education, job opportunities and income, access to nutritious foods and physical activity opportunities, polluted air and water, language, and literacy skills. Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. The five domains are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community contacts. And then we're going to go back and revisit those. So the economic stability is in the United States, 1 in 10 people live in poverty, and many people can't afford things like healthy foods, healthcare, and housing. The education access and quality, people with higher levels of education are more likely to be healthier and live longer, In fact, those with lower levels of education are more likely to have health problems like heart disease, diabetes, and depression. The healthcare access and quality, the many people in the United States don't get the healthcare services they need. About 1 in 10 people in the United States don't have health insurance. People without insurance are less likely to have a primary care provider, and they also may not be able to afford healthcare services and medications that they need. The neighborhood and built environment, the neighborhoods people live in have a major impact on their health and well being. Many people in the United States live in neighborhoods with high rates of violence, unsafe air or water, and other health and safety risks. Racial and ethnic minorities and people with low incomes are more likely to live in places with these risks. In addition, some people are exposed to things at work that can harm their health, like secondhand smoke or loud noises. And then the last, the social and community context again, that is people relationships and interactions with family, friends, co-workers, and community members that can have a major impact on their health and well-being. Many people face challenges and dangers they can't control, like unsafe neighborhoods, discrimination, or trouble affording the things they need. This can have a negative impact on health and safety throughout life. We briefly introduced you to this term to you last week, but let's look at it a little further. Political determinants of health are political systems and strategies that have historically and currently disadvantaged or advantaged individuals that may serve as the root cause of many injustices and inequities in society, such as voting, government, and policy. These political determinants of healthcare and around voting, government at all levels, and policy, which include laws and regulations that are enacted that may impact the individual communities and organizations and society. The Men's Health Equity Institute focuses on several programs. One program that we have is the Men's Health Equity Initiative, an equity initiative to address the social determinants of health and the political determinants of health for all men. Education, which is we try to increase an individual's knowledge and awareness about different health topics such as healthy eating, exercising, and managing chronic health conditions like hypertension and diabetes. Research, we like to collect data and do community assessments to really understand what's going on with men in many states. We assess what's going on so we can tackle the root cause of issues. And services, we go out to the community and provide resources for those in need and volunteer our time to community engagement. And last, policy. We advocate for boys and men through legislation by working with local, state, and national elected government officials to create change through policy. Let's move a step further into our panel discussion. You'll hear from three presenters, and then I'll facilitate a panel discussion with the presenters. I'll turn it over to Deshauna as she addresses men's health in the U.S. Mrs. Deshauna Ballard.
Hello, everyone. I'm Shauna Ballard, and as Jacinta just stated, I'll be talking about um, men's health in the U.S. So, first, we can begin by looking at life expectancy in the United States. And as she mentioned before, life expectancy is the number of years a person is expected to live. And for men, that's roughly 76 years. For women, that is 81 years. So, if you compare men and women, you see that there's a 5 year difference. And you may ask, why so? So there are various factors that contribute to that difference. The first thing is that men actually take more risk than women. So they engage in more activities that could put them at risk for like dangerous outcomes. So some examples of those include biking, maybe driving drunk, and homicide. And additionally, men are more likely to engage in jobs or, just have careers that might put them at higher risk for a dangerous outcome, such as being in military combat or in firefighting. Those are just some examples. Other factors that contribute to this discrepancy include involve health. So men are less likely than women to seek primary care. So as a result, they're less knowledgeable about the true status of their health, and that places them at a greater risk for negative health outcomes. So looking at this chart, we can see how life expectancy has changed over the past 70 years. So we see that in 1950, when looking at men and women's health, that the average life expectancy was below 50 years old. But as time progressed, we see that the average life expectancy increased. However, the gap between men and women never changed. There was always a consistent gap. So now let's look at life expectancy and add race into the picture. So we see that for males, white males, the average life expectancy is 77 years old. And for Black males, we see the average life expectancy is 72 years old. In contrast, for white females, the average life expectancy is 81 years old. And for Black females, the average life expectancy is 78 years old. And again, you may ask, why so? That is because Blacks have higher death rates from all causes of mortality in all age groups below 65 years old. So that includes heart disease, stroke, and diabetes. And Blacks are more likely to report being unable to seek a doctor due to cost. So that's one of the social determinants of health that we discussed before. Also, there's a concept called weathering. And so, with weathering, Blacks are more likely to experience premature aging and earlier health decline than whites. And as a result, this decline can accumulate across the lifespan and be passed down to generations due to socioeconomic and environmental stressors. So let's look at the top 10 leading causes of death in the US. So we see the number one leading cause of death is heart disease, followed by cancer, accidents, chronic lower respiratory diseases, stroke, Alzheimer's disease, diabetes, nephritis, influenza and pneumonia, and intentional self harm, such as suicide. So looking at men, the top 10 causes of health are kind of similar. So we see heart disease is number one again. The second is cancer, followed by accidents, chronic lower respiratory diseases, stroke, diabetes, Alzheimer's disease, intentional self-harm, which is known as suicide, chronic liver disease, and kidney disease. Which leads us to our last slide. So I'm going to end with talking about current trends in men's health. The first trend actually involves a healthy diet. So there's a greater focus on trying to implement a healthy diet into one's lifestyle, especially for men. And healthy diets are important because they're a major preventative factor for a plethora of diseases, especially those diseases that we just mentioned. And it's been demonstrated to actually improve life expectancy for men. Furthermore, it's been found that healthier diets, excuse me, such as vegetarian diets, are related to less carbon emissions being emitted into the environment. So it also helps from an environmental standpoint as well. The second topic that is been growing in interest in men's health is male contraceptive use. So there's more of a focus on improving male contraceptive options because as of now, there are a few options available. So there's more of a focus on developing hormonal pills due to men taking more interest in taking control of their family planning practices. The next topic that's growing in importance is actual mental health. So, within the present society, there's been less of a stigma in terms of being able to like seek out professional help if you have like anything going on in your life. And that is true for men as well. So, men are taking more of an interest of taking control of the things that might impact them and it might cause a negative impact on their emotions. Another topic that is of importance in men's health is actually COVID. And that's because men are more likely to die from COVID than females. And this is very interesting because we talked about like the social determinants of health and various lifestyle factors that contribute to health. And if you have poor health, it could actually increase your risk of a negative outcome from COVID disease. And the last topic that has grown in interest is actually prostate cancer. So, a male's prostate is the organ that produces semen for them, and risks for prostate cancer include a high fat diet, obesity, a family risk of breast and ovarian cancer, and also race, because African American men are 2 times more likely to develop the disease. So, yes, thank you.
All right, so my name is Antoine Martin, and I'm going to talk a little bit about the contributors of poor health. Um, so some of the first things that come to mind when we talk about contributors to poor health are obesity, diet, physical activity level, and the lack of physical exams. And I'll talk a little bit in detail about each one of these on the next few slides. So the first thing that comes to mind when we talk about obesity is body mass index, or also known as BMI. And BMI basically is a measure of body fat based on height and weight that applies to adult men and women. So the higher your BMI, the higher your risk for certain diseases such as heart disease, high blood pressure, type 2 diabetes, gallstones, breathing problems, and certain different cancers. So if you look over here on the right, on the various different categories, we see that for someone who is underweight, they have less than 18.5. If they're normal weight, they're between 18.5 and 24.9, overweight 25 to 29.9. And if they're considered obese, we're talking about over 30 or greater. Another factor to consider when we're talking about obesity is waist circumference. So measuring waist circumference, it helps screen for possible health risks that come with being overweight and obese. If most of our fat is around our abdomen rather than your hips, then you're at a higher risk for heart disease and type 2 diabetes. This risk, it will go up with a waist size that is greater than 35 inches for women or greater than 40 inches for men. So to correctly measure your waist, you want to stand and place a tape measure around your middle and just above your hip bones. So you measure your waist just after you breathe out. And you can see over here in the diagram, it's got the various different risk categories for where one's waist circumference will fall. And then it also shows you, make sure you measure around the belly button to get an accurate measure. And then here's an example. So let's assume that someone is 5'10" and they weigh 250 pounds. Their BMI is calculated to be 35.9. This is equivalent to being obese. If this person wanted to reduce or decrease their BMI, losing about 5 or 10% of their original body weight, well, losing 5 or 10% of their body weight is ideal. So what is 5 or 10% of their body weight? Weight reduction of 5% is about 12.5 pounds and 10% is 25 pounds. So 5% BMI is now 34.1 and 10% BMI is now 32.3. So it is possible, particularly through good dietary and exercise habits, to reduce one's body weight or getting the BMI lower. You only need to participate in activity for almost 3 months consistently for something to become a habit. That's only 3 months. So make it even more practical. If we wanted to reduce our weight by just 5%, you would have to lose 4 pounds a month. And that's basically 1 pound a month, 1 pound a week. And if you wanted to lose 10% of your body weight, that's about 8 pounds a month or 2 pounds per week. So it is doable. Focusing on dietary guidelines. A healthy diet, it can prevent and reduce your risk for many chronic health conditions. Below are some of the things that you can do to reduce your overall risk and manage those conditions that you may already have. So I think one that's very popular, most people know, is eat more fruits and vegetables. Limit red and processed meats, consider eating fish and chicken instead. Increase your fiber intake and limit alcohol intake. Another good kind of mechanism to kind of work on dietary intake is knowing how to read nutrition labels. Label reading is an important skill in gaining control of your nutrition and leading a healthy lifestyle. So the nutrition facts label enables you to determine the amount of nutrients in one serving of food. So this is a really good kind of like a color mechanism to know which foods do what. If your food item that you're eating is blue or purple, typically the examples would be like blackberries, eggplant, blueberries, and purple cabbage. Some of the health benefits of eating those type of foods are supporting your eye health, lowering your LDL cholesterol, boosting immunity, aiding in your healthy digestion, fighting inflammation, and reducing tumor growth and related to cancer. And then if you're coming across food items that are orange or yellow, some examples would be carrots, oranges, apricots, butternut squash, pineapples. These are things that can reduce risk of prostate cancer, lower your LDL cholesterol and blood pressure, promote collagen formation and healthy joints, and work with magnesium and calcium to build healthy bones. If we're looking at red food items, we're looking at beets, cranberries, grapefruit, red bell peppers, red onions, tomatoes, radishes, watermelon. Some of the benefits associated are reduced risk of prostate cancer, lower blood pressure, reduced tumor growth, lower LDL cholesterol levels, and support joint tissues with dealing with arthritis. So there are a lot of similarities to the ones that we saw before. If we're coming across with green food items, artichokes, green apples, broccoli, celery, avocados, kale, spinach, all these things can reduce cancer, can lower your blood pressure, your LDL cholesterol. It can help with digestion, can support eye health and vision, and boost your overall immune system. And then if we're coming across white food products, we're looking at cauliflower, garlic, ginger, mushrooms, onions, shallots, turnips, white peaches. These are things that can boost our immune system and support it, can balance hormone levels and reduce the risk of colon, breast, and prostate cancers. Another kind of thing to take in consideration when we're talking about what contributes to good health is hydration. Hydration is the process of adding an adequate amount of fluids, primarily water, to body tissues. Our bodies, need proper hydration for metabolic processes such as supporting blood pressure, our fluid and blood volume, controlling body temperature, our heart rate, maintaining a healthy metabolism. These are all things that we get when we're properly hydrated. And so to ask the question, how much water should I drink? Drink enough fluid so you rarely feel thirsty and produce enough urine that is colorless or slightly yellow. General recommendations of total water revolve around for women, approximately about 2.7 liters or 91 ounces per day. And for men, it's about 3.7 liters or 125 ounces daily. And just to know too, that water, it is essential to life. You can go long periods of time without eating, but you must drink. While some other beverages such as milk and fruit juice provide nutrition, overconsumption of high calorie drinks can lead to weight gain. You should not drink sodas, sweet teas, juice, and other sugary beverages unless you're drinking them in moderation. Another contributor to poor health outcomes too is sedentary lifestyle. So sitting for long periods of time is bad for your health. Prolonged sitting is associated with being overweight, leading to and affecting chronic health, such as hypertension, diabetes, various forms of cancer. So examples like watching TV, playing video games, telephone, computer, you want to limit that. That's another thing we want to moderate. So spend more time up and about, moving, getting some type of physical activity versus sitting down and doing nothing. And just kind of expounding on physical activity, when looking at an acronym called FIT, which stands for frequency, intensity, time, and type, breaking those down, frequency, do some type of physical activity or exercise every day. When we look at intensity, do something that at least makes your heart beat faster. There are 3 different exercise intensities, but you should focus on at least one moderate. So if we're going to do mild intensity workout, very slow walking and talking is that type of mild intensity. Other examples include yoga and stretching. If we're doing them at a moderate level, faster walking with a purpose, your heart beats at a lot faster. And examples of that would be like riding a bike slowly or dancing and eating, or easy workouts. And then when we're talking about vigorous workouts, we're talking about something that's going to make you sweat, make you breathe really hard. So this includes sports, running, aerobics, fast bicycling. And then looking at the other part of the acronym, time. The time you spend doing it should be at least 60 minutes per day. Break it into small amounts of like 3 to 5 minutes at a time if need be. And then last is type. There are different types of activity. You have resistance or strength training, so working with weights, resistant bands, or your own body weight. So examples of that could be like pull-ups or push-ups. And then you have aerobic, like walking or running. And then stretching. Stretching helps prevent injuries by keeping you flexible. So try to find time throughout the day to incorporate, this acronym into, your daily activities, and this will kind of help alleviate some of those poor health outcomes. When looking at the benefits of physical activity, for example, it helps to strengthen your heart and lungs, helps you maintain a healthy weight, can improve your mood, improves the quality of sleep that you get, improves your overall body functioning. And so some of the things that you can try are exercising on commercial breaks during your favorite TV shows, doing 10 minutes when you wake up and 10 minutes before you go to bed of some type of physical activity, find an accountability partner, someone that, is responsible and says, hey, did you do this today? You know, we said that we were going to try to, you know, increase our activity to at least, I don't know, 15 minutes a day, you know, finding that person that's going to keep you accountable. Make it fun. I'm the type of person that, you know, I really hate working out in the gym, but, you know, if you put it into some type of sport, I'm all for it, some type of physical activity. And then trying new routines and styles of exercise. Nothing wrong. Zumba is not my thing, but I know some people who like that. I've tried it once, not for me, but I tried it. Hey, some type of physical activity, just not for me. And then do what you like to do. There's so many different types of physical exercise. It doesn't necessarily have to always be focused around the gym. Like I said, it could be sports, it could just be walking, it could be on hikes, biking, various different things you can be doing. Just find something that you enjoy doing.
Thank you. That was great, Antoine. So good afternoon. My name is Dr. Kristen Allen Watts. And for this section of the presentation, I will briefly review statistics on some of the top leading causes of death in men. Specifically, we'll talk about diabetes, we'll talk about cancer, and we'll talk about cardiovascular disease. We'll also examine ways to modify controllable risk factors to reduce disparities and promote health and well-being. So let's first talk about hypertension. So high blood pressure is when your blood pressure, which is the force of your blood that's pushing against the walls of your blood vessels, is consistently too high. Having hypertension puts individuals at great risk for heart disease and stroke, which are leading causes of death in the United States, as Ms. Ballard told us earlier. According to the CDC, nearly half of the adults in the US have hypertension. Only about 1 in 4 adults with hypertension have their condition under control. And a greater percent of men, about 47%, compared to women, about 43%, have high blood pressure. High blood pressure is more common in non-Hispanic Black adults, about 54%, than in non-Hispanic white adults, which is 46%, non-Hispanic Asian adults, and Hispanic adults. Among those recommended to take high blood pressure medication, blood pressure control is higher actually among non-Hispanic white adults than non-Hispanic Black adults, non-Hispanic Asian adults, and Hispanic adults. And we talked a little bit about those social determinants of health earlier in the presentation. So diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. There are 3 types of diabetes. We have type 1 diabetes, type 2 diabetes, and gestational diabetes, which we won't discuss for the purpose of this lecture. Type 1 diabetes is often caused by an autoimmune reaction, and that just basically means that the body attacks itself by mistake that stops a person's body from making insulin. Approximately 5 to 10% of the population that have diabetes have type 1. Compared to type 2 diabetes, which is where the body doesn't use insulin well and can't keep blood sugar at normal levels. Approximately 90 to 95% of the population that has diabetes has type 2 diabetes. Diabetes puts both men and women at great risk for heart disease, stroke, vision loss, kidney failure, and even amputation of the toe, foot, or leg. But some diabetes problems hit men directly below the belt. And what I mean by that is men that have diabetes are more likely to have erectile dysfunction. They're more likely to have an overactive bladder. They're more likely to have male incontinence, urinary tract infections, and retrograde ejaculation, which is just semen that's released into the bladder. So a cell is a fundamental unit of life. All things are made of cells. Unlike normal cells, cancer cells ignore the signals to stop dividing, to specialize, or to die and shed. So they grow in an uncontrollable manner, and then they're unable to recognize its own natural boundary. The cancer cells may spread across areas of the body where they do not belong. So across every type of cancer, men have higher rates of getting and dying from cancer than women. Common types of cancer in men, we have prostate cancer, which begins when the cell in the prostate gland starts to grow uncontrollably. We have colorectal, which begins when the cancer cells in the colon or the rectum start to grow out uncontrollably. Lung, which is caused by exposure to chemicals and other particles in the air or smoking tobacco. And skin, which is repeated and unprotected skin exposure to ultraviolet rays from sunlight, as well as man-made sources such as tanning beds. So you talked at length about some common chronic conditions or diseases that affect the health and well-being of men. Let's discuss how risk factors play a role in rates of morbidity and mortality of chronic diseases. So a risk factor is something that increases the chance of developing a disease. Risk factors fall into two categories. They're either uncontrollable or controllable. Uncontrollable risk factors are those that you cannot change. Some examples of these would be age, gender, race or ethnicity, and family history. Controllable risk factors are those that can be changed or modified, and these include diet, exercise, obesity, smoking, and alcohol consumption. So while having multiple risk factors can increase your chance of developing a certain type of disease, having only one does not mean that you're safe. Any single risk factor can increase your likelihood of developing diseases. So we've discussed how we can control or modify risk for developing a certain type of disease. Obesity is actually one of those risk factors that you can modify through proper diet and physical activity. That if you do not modify, it can actually result in serious health issues that can potentially be life-threatening, including hypertension and type 2 diabetes. So obesity is the #1 risk factor for hypertension and diabetes. Modifying your diet can help improve weight management. Regular physical activity is associated with lower blood pressure and reduced cardiovascular disease risk, for example, heart attack or stroke. Modifying sedentary behaviors or lifestyle, participating in low intensity physical activity can reduce incidence of diabetes. And exercising improves your blood glucose control or insulin sensitivity in type 2 diabetes patients, and may prevent or delay the onset of type 2 diabetes. So what can we do? What can be done about this? Well, we can start by focusing on one aspect of health at a time and then building onto it. So health affects more than just the individual. When we think about health, we need to think from the individual all the way up to the societal or society. So your family and your friends, where you go to work, school, church, etc., the community in which you live, and policies and programs that are in place in your community that can either help you thrive to make a healthy choices, or they cannot help you make healthy choices. So behavior change is complex. It can be overwhelming, but it can be accomplished with proper planning and execution. When thinking about changing a specific behavior, you want to be flexible. So remember that what works for others may not work for you. Understand that there is no quick fix to anything. It will take time, as Mr. Martin or Antoine mentioned earlier. It takes about 3 months for behavior change to actually take root. So just know that it's going to take some time. Also, that it will be rewarding. So, and find rewards every now and then. So reward yourself. First, it's a lifetime reward, but then find little ways to reward yourself in between. And then, as Mr. Martin mentioned earlier, make it fun, be creative. I like Zumba. I know it's not for everybody. I did it once or twice. And then the pandemic happened, but it was a way. I used to dance, so it was fun for me to get out and dance rather than running. I hate running. So that's why this program is in place and it's here. We want to improve the lives of men across the United States and help increase the life expectancy among men. And we plan to do so through the pillars that we discussed earlier in this presentation.
Okay, so we're going to move on to our, our panel discussion for our presenters. The first discussion question is for Deshauna. Deshauna, how has men's health shifted through history, and in what ways does masculinity and culture impact health for men?
So I think men's health has shifted in the sense that it's actually been more of an increased focus on trying to improve it. As I was discussing earlier, we actually saw that life expectancy for like men and women was below the age of 50 years old. So that was pretty low. So I mentioned previously in another talk how men are the pillars of our community. So to protect their health means that we're protecting the foundations of our community. So I think men are more focused on trying to protect themselves and really cultivate their health so they can be around for their family, so they can support them from a protective standpoint. Additionally, in terms of how masculinity and culture impact health for men, I just think it wasn't popular for men to go to the doctor for various reasons. I know a lot of men that just chose not to go to the doctor because they feared hearing like negative reports, or they just didn't necessarily want to deal with having to like undergo a new medication regimen. So I think that kind of related to masculinity in a sense, because it's like an area of potential weakness. So I think now people are just taking their health in general more seriously. And I think men are trying to do more and just kind of ignoring things that might have prevented them from seeking proper health care before.
That's a great answer, Deshaun. I like that. I totally agree. Okay, my next question is for Mr. Antoine. What are some Antoine? What are sorry? What are some perceived barriers for men in healthcare, and how might those barriers impact health for this group?
Yeah, thank you. I think answering this question, I'm going to kind of echo off of what Deshauna had said too when she talked about masculinity and culture, kind of focusing more on like gender specific barriers. One that comes to mind is like this notion that men are supposed to be strong, resilient, and tough, and they're supposed to be able to push through adversity. And sometimes when you put this in conjunction with like accessing medical care services, this can be perceived as like debilitating or a sign of weakness. So just right off the top of my head, an example, it's actually last weekend I was talking to a friend. He stuck his finger with a rusty nail. So when I asked him about it, I was like, hey, did you, talk to your doctor or whatnot? And he's like, oh, no, it's not that big of a deal. I put some soap and water on it and put a Band-Aid on it. And, he's like, it's not that big of a deal. Like, I'm a man, this and that. And I'm like, no, 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 no. Like, this is what we're talking about. Like, at least call your doctor, because I'm pretty sure you need to put some type of antiseptic on that cut, because you never know. You might get an infection or some type of disease. And, whether you lose your finger or worst case scenario, you might end up dying for something because you didn't go to the doctor to get this checked. So I think that's something to take in consideration. And then just kind of thinking about gender specific barriers, another thing that comes to mind too is the position and the roles that men play in their families. So for example, if we're talking about men being like the primary source of income in the home, they may prioritize work over their health because the family is dependent on them. If they are not working or if they lose their job, then that's going to affect the family down the road. And then one more thing that comes to mind when we talk about barriers in healthcare too is, I would say, the lack of program funding specific to men in terms of providing resources. So we see a lot of program funding for women or women and children, but you see limited or practically no funding for programs that allocate resources to men. And just to give an example, looking at the states that expanded Medicaid and looking at the states that didn't expand Medicaid. So for example, I'm a transplant from Georgia. In Georgia, they did not expand Medicaid. So the criteria for getting Medicaid in Georgia is you have to be a pregnant woman, have to have some type of disability, have to be elderly, or have to be legally blind, and a couple other things. But if you're a single healthy man, but you live in a low income area, you're not eligible for Medicaid. And then when thinking about that, okay, that's a one barrier right there in itself that are going to prevent men from being able to access healthcare services.
Great job. Great answer, Antoine. Yep, that is a great answer. There are a lot of barriers that men have and go through that many people are not aware of. So great answer. Okay, Kristen, Dr. Alan Watts, what are some strategies to address men's health to help reduce disparities among men and women in the U.S.?
Okay, well, it's really hard to get go after Deshauna and Antoine because both of their answers were perfect. Um, so I kind of feel like this is a complex question and it requires multiple layers. I think in order to help address sustainable strategies from we have to look at it from the personal and environmental factors. So look at it from the individual all the way up to societal levels. The most important way I think that we can address men's health is to listen to the voices of men. I think oftentimes we kind of overlook the fact that men have voices. So we're in a very male dominant society, but when it comes to health, you don't really hear a lot of things about men or their health, which is what the previous two panelists just mentioned. And so really giving them a platform in order to discuss and talk about these issues that have impacted their daily lives is important. And then having a larger discussion on how we can solve that problem is key. I think this is why Men's Health Equity Institute is so important and unique. Each one of us on this panel, and including Dr. Logan, have expertise in either community advocacy, partnerships, health education and promotion, developing programs, whatever you can think of. And so it gives us that background to be able to lend a voice to men so that we can start tackling some of these important issues and really build a firm foundation to move forward with.
Thank you for that, Dr. Alan Watts. You did that was an awesome answer as well. I do have one follow-up question, and it is for Mr. Antoine Martin. Mr. Martin, what would you say? Well, first of all, by you being a male, and you mentioned something about like some men are reluctant or either resistant to getting to get their health care taken care of. Why do you think some men have fear of going to doctor's offices and getting like annual checkups, like their prostate checked and stuff like that? Do you think that there are like some fears there that prevent men from wanting to go to the doctor's office? Right, and also are either not being touched in certain ways, by some tests that they might need to have done?
That's a good question. I don't know if their fear is any more different than what you would experience with women. I think a lot of it has to do with kind of the culture built around men. Just kind of going back to like the family kind of perspective, think about in the traditional cisgender heterosexual family, who's primarily responsible for the health in the family? A lot of times it's the wife or the woman in the family. Not that men can't be, it's not that men don't take their kids to, the hospital or the doctor, but primarily that falls on the women in the family. So I think for men, and kind of going back to what I was saying too, is that their priority is work. So if they're working long hours, and most doctors' offices, they're open from 9 to 5 p.m. So, and that's traditional work hours. So if I've got to work, that's the priority, and I'm working Monday through Friday, or maybe even sometimes weekends, then that's going to limit my ability to get to my doctor. Another thing that comes up too is like the lack of quality jobs, especially right now with COVID-19. There's jobs available in terms of quality, like ones that are actually paying a substantial amount, but, does everyone have full healthcare coverage? That's one of the things that I've kind of seen amongst other men around me that, if you didn't go to college or if you haven't put in 10 to 15 years at a place or moved up in an organization, your hours, you may not necessarily be working 40 hours, or you may not be getting full benefits. I've seen employers, for example, they'll hire somebody but only have them work, part-time, or they'll hire somebody and only have them work 39.75 hours, preventing them from hitting that 40, so they're not getting those additional benefits. So I don't necessarily, that fear does exist, but I think a lot of it really is the culture that's built around. And kind of going back to what Dr. Kristen Watts was saying was that, I think you have to look at it from the individual level to kind of the top level too, about how these systems impact people's ability to access healthcare.
Thank you for that response. I appreciate that. Thank you, Dr. Kristen Allen Watts. Thank you, Miss Deshauna Ballard. Thank you, and like I said, Antoine Martin. And we're going to have our final remarks from our founder and CEO, Dr. Georgiana Logan.
Thank you so much. That was such a wonderful presentation. Lots of good information that was highlighted on this evening, especially centered around men's health, since June is Men's Health Month. I want to thank Mrs. Deshauna Ballard, Mr. Antoine Martin, and Dr. Kristen Allen Watts for your contributions, and to you, Jacinta, for serving as the moderator on this evening. Very well done. And so as we move forward, I want to talk about this scholarship opportunity. So over at the Men's Health Equity Institute, we really try to do a lot of great things to give back. One of the ways in which we're giving back for the month of June is we have this 2021 academic scholarship opportunity. And so what that means is we're looking for any eligible high school senior or a current or a man who's currently enrolled in a 2-year or 4-year college or university, can be undergraduate or graduate level. And we're looking to give away 3 $500 scholarships to support your academic success. And so please look at our social media platforms: Facebook, Men's Health Equity Institute; Instagram, Men's Health Equity Institute, or just go visit www.menshealthequityinstitute.org to learn how you can apply and maybe become a recipient of one of these 3 $500 rewards. Also, we have some upcoming events. Again, June is Men's Health Month, and so we have a lot of great things planned to highlight men's health. So on next Thursday, we're actually going to be talking about or looking at health disparities and premature death among African-American men, and really putting a call to action to these disparities that we are seeing. African-American men are dying at alarming rates, and they're dying really early. And so we want to talk about that. Also on June 24th, we're going to be talking about HIV awareness, because June 27th is National HIV Testing Day. And so we know that although we have different mechanisms and modalities in place to kind of help prevent someone for having an HIV diagnosis, these rates are still not where we want them to be. And so we need everybody to go out and get tested. If you've never been tested, we want you to go out on June 27th and get tested for HIV. Thank you so much. Thank you all so much for joining us on this evening. We hope that you really enjoyed our presentation as we highlight different various facets of men's health throughout the month of June. And we look forward to you joining us next Thursday as we go a step further in the conversation. Thank you so much.